Good morning you guys, it's Karen, and I thought I would do a video answering the most asked question over the last couple of weeks, which is what's happened to your eyes. You may remember that I've had my lips done. I had lip filler done with Dr. Bong, and on the same day I had anti-wrinkle injections. So I had Botox done, I had it done around my crow's feet here, and I had it done on my forehead area, or sort of eyebrow area, as a kind of brow lift. Unfortunately, it has not produced the effect that I wanted, but I wouldn't go so far as to say it's, or would I, that it's gone wrong. Do you remember I did that video? Let me give you a quick background for those of you that are perhaps new. I have been having anti-wrinkle injections, Vistabel, Botox, etc., along my eyebrow area and kind of glabella area, which is this middle bit, for about 8 years, something like that, in order to hold my eyebrow. This is what I want to happen. I wanted my eyebrow to be held in place here. If I got a little bit of a lift with it, great, but I just wanted to not be able to, when I was making expressions, for this not to happen. I can't move it very much at the moment. I can move it a little bit. And I found a couple of practitioners where I live that did a great job, but of course, as always happens in life, they left. One of them left and I just couldn't find any trace of her. I didn't even know she had left, and I was quite devastated. And then when I eventually did find her, she'd left to have a baby and had actually given up. Then the other one was a nurse, and she was going back into funny enough, to work in the hospital that I worked in. So ever since then, I've been trying to find somebody that can achieve what I want to achieve, and there's just everybody that I found there's been issues with. I found some lovely girls, but every time I turned up there was a problem with my appointment. They'd forgotten it, they were late, and that's just not the way. That gives me anxiety. You know, when I turned, the last appointment I had with them, I turned up and they said they didn't have an appointment for me, and I knew that I had made an appointment, and so I had to go away and come back another day, and I had to rearrange my whole schedule. Another time when I had it done, some people are like, but there's barely any movement there, but I'm like, I want no movement. And if you're paying that amount of money, because it is a few £100s, I feel like if you can achieve no movement, then I would like no movement. And normally with these appointments you get a 2-week follow-up, but I felt like these girls didn't want to do the 2-week follow-up, and they were like, oh well, there's not much movement. But it's like, well, I asked for no movement, and by putting in a little bit extra, they did achieve the no movement that I wanted. But like I said, I just couldn't cope with the, I guess, customer service issues. Anyway, like I said, there's been many more. Another one I went to made absolutely no difference to my eyes at all. There was still, you wouldn't have known I'd had anything done. There was no change whatsoever. And then of course you guys know that last year I went to the Girls' Day Out show, which funny enough was just this weekend past. I went to them in Glasgow, and I had it done by a doctor there that I'd actually heard of his name, which is why I stupidly thought it would be okay, because I know that he's actually a very well respected surgeon. That clearly didn't translate into cosmetic procedures, if you like. He wasn't very good. He didn't have a very good bedside manner. He caused me a lot of pain on my lips. My lips were extremely bruised and sore, but I know that you can expect that from lip injections, but I remember he was just, like, I was telling him this is beyond painful, and if I could have spoken I would have said stop, but I was like crying, you know, it was so painful. And he was, I don't know, I found him a bit rude, a bit arrogant, and he was doing my Botox, and I remember he said, I'll get rid of your horizontal lines, and I was like, I don't have any horizontal lines. I'm pretty critical of myself, and I can tell you where I've got wrinkles, and you know, even if you can see a little bit, I'm like, yes, there's a little wrinkle there, but I know that I don't have horizontal lines. I'm very lucky not to have horizontal lines. And when I say lucky, I have been led to believe over the years of having Botox, and also, well, I was going to say also from working in the hospital. That's not true. Working in the hospital, I knew that the safety profile of Botox, but I've been led to believe that if you've got horizontal lines across your forehead and you want to get rid of those, and you also want to stop the lines that are vertical here, and you want to stop your eyebrows pulling in, that it's virtually impossible that you can have one or the other. You can stop one or the other, because if you do both, your eyebrows are going to droop. So I said to him, I don't have any horizontal lines. I don't want you to do that. And he was like, he was pretty insistent on doing it because he said, you know, you're going to be displaying my work, and he was giving me a discount, and, you know, and so I allowed him to do it, and I shouldn't have done, because to me, anything kind of above the eyebrows for me seems to make my eyebrows droop. I've done a whole video on that called Botox Gone Wrong, which I'll link for you in case you want to watch that to get further details. So that was last year in November. Then in about February this year, I went to Dr. Bong and I had some more Botox with Dr. Bong, and I had that before starting my Plexa treatment, and it worked fantastically. He did a great job, and you know, I totally felt comfortable with him. It was everything I needed him to be, and it worked very well. It wasn't as frozen as I wanted it to be. I wanted a little bit less movement, but it didn't have any negative effects. So then after that, I had my Plexa treatment done for my hooded eyes, and I had 3 treatments done. I've done the 3 videos on that, and I felt like afterwards I could see a difference in texture for sure, and that's what most of you have said. A lot of people have said you can see a huge difference. Some have said they can barely see any difference. And I think the majority, including myself, I can see a bit of a texture difference, and I can see a slight difference. And so I thought, well, if I now have my Botox, that would be wonderful, because it would just hold that in place. It would stop it wrinkling when I'm talking, you know, with my expressions, etc. And I feel like I would be happy. So it isn't actually something I would have thought of having done at the time because of my financial situation. I couldn't afford it, but I was offered this discount, as I explained, by Dr. Bong. Now, I already knew Dr. Bong. I had had my Plexa done with him. I had had my Botox done with him before. And then I went and had my lips done, and on the same day I had my Botox done. I don't think that it's nothing like the situation with the previous guy, who, by the way, the previous guy is from a company called Botox, Beautox. And I think he even offers something called the brow lift, and I would not recommend going to him. And there's another girl who's got a video out now as well about how he's completely messed up her lips. I was lucky he didn't mess up my lips, as in the look of them, but certainly the feel of them wasn't great. About it going wrong with my eyes, I had a lot of comments saying that if you just go to a reputable surgeon, if you go to a nurse, if you go to a dentist, that it's all about the practitioner, and everybody has their own opinion on that. And my personal opinion is that it is not down, it's not 100% down to the person you go to. Of course, that plays a large part in it, because like myself, if you make an error and go to somebody doing it at a show, you're taking a bigger risk. You don't know them, you haven't had a long consultation. And actually, even that guy admitted, the guy that did my eyes at the show admitted that because he was rushed on the day because they wanted to fit as many in, he didn't feel that he had time to listen to exactly what I wanted. That's what he thinks was the problem. He won't admit that he put it in the wrong area, that he didn't do the right thing. Oh dear. Sorry about that, Pup was barking at the window. So what was I talking about? Practitioners. So I would estimate that I have seen between 10 and 15 different practitioners, varying from beauty consultants where they were administering the anti-wrinkle injections and they had to get it signed off by a doctor first, because that's the way it works. So there was usually a visiting doctor or a doctor on premises. To most of the people that I have been to see have been nurses, or like I even went to my dental practice where I have or had my dental work done. The guy has since left, and he didn't know how to achieve what I wanted either. But the kind of common thing in all of those consultations and in seeing all of those people is that they all explained that it is such a fine operation that it is always a possibility that your face will droop, that your eyebrows will droop, and that you have to get it to the millimetre to the right muscle. And if they don't, because everybody's muscles are different, there is always the chance that it can droop and that the eyebrows can droop down. And so that, like I said, is a common thing that I've constantly heard that. So I'm always aware of that. I had it done for my wedding, and I remember thinking, please just let this be the time that it doesn't happen, because that would have been a disaster. So I feel really lucky that until this last year, it's never happened to me. And I have gone to some bad practitioners, But until last year, it had never ever gone wrong in that way. I'd never had it where my eyebrows had drooped. I do now carry around a little sheet of where the points have worked from other practitioners, but I've got two different ones. Like there's different, I can't pinpoint exactly where the injections need to go, and also it's not, you can't really go in and say, right, I want you to inject me here, here and here, because they all have a different way of doing it. And so I would say there's probably 3 different ways that it's been done on me where it's been a success. It's maybe not been as frozen as I want, but it's been a success in that it has held my eyebrows in place. What I personally think has happened on this occasion is he injected a little bit on my forehead, and I now feel that wherever I go, I will be saying to them that I don't want anything above here. So above my eyebrow, yes, but nowhere higher than above my eyebrow. I think if you go along my eyebrow and in the middle, that seems to be the thing that for me holds the eyebrow in place, sometimes gives it a little lift, but more often than not just holds it in place. And I remember actually one nurse, and I remember the day she told me she was going, I came in to see her, and I'd been to see her quite a few times. She went, "You're going to kill me." And I was like, "Don't tell me you're leaving." And she went, "Yeah, I'm going back to the hospital." But she used to say she wrote it down as a bleb just about here, and it was to give a tiny little lift. And she used to always be worried about the Spock effect. But I don't seem to react like that. My eyebrows are never like completely, you know, raised. And she used to put a little bleb there, but apart from that, it was just all along my eyebrows. And so with Dr. Bong, I did have some above the area that I'm comfortable with. So I now realise that for me personally, for my muscles, I'm not going to ever have it done above that eyebrow line. And I suppose that answers the other question that I've been asked is, will I continue to have it? If I can afford it in the future, it's something that I would definitely have done again. It's not, like I said, I'm not putting any blame. I think some people will think I'm mad to have it done again when it's gone wrong twice, but when you look at the statistics of the fact that it's gone wrong twice out of, I'd say I've had it done 3 times a year for 8 years. So out of 24 times, twice it's gone wrong. It's not a high statistic, and I already knew that that was the case. I have also had comments saying that it's unsafe. I would refer you to Dr. Bong's video explaining how it's not just, it's a poison, therefore it must be unsafe. It really isn't like that. And as I've said before, it's been used in hospitals for years and years and years. It was used in the hospital I worked in. It's used for medical conditions. It's even used in children. So the safety profile I'm happy with. The thing is, this time, although my eyebrows have gone down, and I'll show you a picture of the difference of what it looks like, what I looked like before and what I look like now, so you can see what's happened. Because I think some people will say, oh, I can't see a difference. It's amazing how we all see the world very, very differently. Like with my plexer, I know that, like I said, some people said they could see a small difference. Some people said none, some people said a huge difference. It just depends on how you're looking at somebody, but I'll show you a picture. But it's nothing like it was previously. If I've still got the pictures from last time, I'll show you, although they'll be in that video that I mentioned. So it means that although this has pushed my eyebrows down and made my eyes a little bit more hooded, what it has also done is he has achieved what I wanted in that I can't pull my eyebrows in. So it's kind of amusing, because when it went wrong last time, all that happened was my eyebrows went down, but I could still pull them in. So they were further down, and I was still able to move, so that to me they looked terrible. Whereas now it's pushed them down, and I've got hooded eyes, but I can't pull my eyebrows in, so the skin doesn't look as wrinkled. Once I got used to it last time and got used to kind of how to do my eyeshadow, I didn't feel as bad about it all. And like I said, this time I know that all I can do is wait. There's no solution to this. Going forward is to wait until there is a little bit of movement. Until there's movement, there's nothing we can do. I had to wait until the 2-week mark to see how much movement I had left. If I still had some movement in this part, it could maybe have been injected to lift it up a little bit, but there's generally no movement in the area, so I just need to wait. And it should take, it's different for everybody. It could take a month, it could take 3 months, it could take 4 months. So I just need to keep an eye on it, and when I can feel and see some movement, I can go back and Dr. Bong will inject to kind of reversed it, if you like. So it's just a waiting game now. But like I said, because I had it done before and I got used to it, and I got used to how to do my makeup, and that actually is holding it in the corners, it doesn't feel nearly as bad as last time. The only thing that is bothering me, there's two things that are bothering me slightly. One is that I probably haven't done my makeup in the best way today. I know that. You guys know I like my black eyeliner. I have even put it in my waterline today, and yes, that makes eyes look smaller. I don't usually mind that, and you guys know I get comments about it all the time, but I've never proclaimed to be trying to achieve big eyes. But because now this is pushed down, my eyes definitely look smaller. So I know that when I put my waterline liner in, there's definitely a difference when I look in the mirror, and it's not always about not liking what you see in the mirror. It's when something is different. I feel like this is something that's never explained or never talked about really with cosmetic procedures. And even I remember I had some filler in my nose to mouth lines once. I've never had it since, and that was about maybe not 8 years ago, maybe 6 years ago. It was when I had my knee operation, actually. So I remember I was on crutches. And it made my face look different instantly. Probably it looks like it did now because I'm a lot heavier now than I was then. But it was like overnight I looked like I had a lot rounder face, and I've already got a round face. And it's the same with this. It's the same with the eyes. When I'm watching videos back, I'm like, oh, I look really different. And that's all it is, because I know that I got some criticism last time saying that I was, because I was upset because I had hooded eyes, but it's not. I did try to explain that it's not that I had hooded eyes, it's that I had hooded eyes overnight and I didn't know what to do with them. And I've already got hooded eyes. I had really hooded eyes overnight, and I just looked completely different. And I think that takes a minute to get used to. The final thing which is bothering me is that when I put my top line on, it is transferring. In fact, it looks like it's transferred now. Let's have a look. Only a tiny bit. It's only transferred a tiny bit. Yeah, it's only transferred a tiny bit. What I'm having to do, I feel, is wear dark eyeshadow, which again won't necessarily make I know how I could do my eyeshadow to make my eyes look much wider, and I don't know how I coped with the transferring thing then. I seem to remember it driving me crazy then, and if I had time to just do my top liner and then sit still and not move my eyes until it completely dried, that would be fine. But a couple of times over the last few weeks, I've put some eyeshadow on, put my eyeliner on, put my mascara on, and then there's a big black line in my eyeshadow. And yes, you can take it off with the eye makeup remover, and then try and fill in your eyeshadow. It just never looks right. It just never ever looks right. So if I do dark eyeshadow, the eyeliner transfer into the crease doesn't show. I think I've preempted all the other questions that would be asked. I know I've been asked before, is there another solution? There isn't an anti-injection that, there's an injection you can get to reverse it, unfortunately. How long will it take? It just depends. It could be another month from now. It could be another 4 months from now. I will let you guys know, of course. If you are going to have it done and you don't want this to happen, just try to go to somebody reputable. And I feel like if you don't have it done on this upper part of your forehead, or have it done as close to your eyebrows as possible, to me that seems to be the risk. But that is not through any, I'm not qualified in it. That's just from my observations over the years and how things have worked. Once I go and have the I suppose you could call it corrective injections with Dr. Bong, I will of course come and talk about it, but you'll see it anyway, hopefully. Those of you that are very observant will see the difference. So thank you very much for listening today. I hope you're all well, and I'll